Let's bring in Dr. Dave Montgomery now. He's a board-certified generalist, a cardiologist, and also host of The Good Doctor Television. Thanks for joining us, Doctor.
Hey, Mitch, good to see you.
All right, so I think the thing that most people are going to care about is, do I have to wear a mask again? And it looks like at this point it's recommendations, but I do want to know from you, what needs to happen? How bad does it have to get in order for masks to be mandatory? And how are we anywhere close to that threshold?
Yeah, I think that New York has been a bellwether for the last couple of years with COVID-19, so I think we do really well to pay attention to what's going on there. The idea of masks is so fraught, Mitch, that I think we lose the message, which is this. The three respiratory viruses that are giving us the most trouble are most easily prevented by blocking the respiratory passages, the nose and the mouth, with a well-fitting, properly worn mask. I think that that's what we should be thinking about, not a mandate, but a desire not to become ill from either of these three in our communities and in our families.
So it's better that it remains as a recommendation, is what it sounds like to me, because you are telling people, here's the best case scenario for you to stay healthy. But I think we've seen how, like you said, fraught mask mandates can be. What do you think would happen in this country if anywhere, perhaps flights, let's say, right ahead of Christmas, the airlines just said, hey, you got to put masks on again. It's required. This is happening again. What do you think would happen?
Yeah, no, I don't pretend to know. I think when we talk about it like that, in a sense, Mitch, it gets classed with like politics and religion, things that I don't pretend to be an expert on. Here's what I will say. When patients come to our office, we're still wearing masks. And I say it's not a mandate. You are protecting the people around you that are more vulnerable. And there are many that are going to come into our office. There are many that are going to be in your community. This is not a mandate, Mitch. This is charity. Are you being a kind human being by simply protecting kids and elderly and other vulnerable people from this virus? I think it should be a choice. Let's stay away from the mandate. If we do it now, if our discipline is good, we don't get to a mandate. That's what I think.
I hope you're right in that scenario. Now, we've got the Tripledemic going on, right? We've got flu, we've got RSV, we've got COVID-19. Oh, and by the way, strep throat is surging. So let's talk about strep throat, though, because I'm surprised by this. This has been around for a long, long time. Why is it surging now in this atmosphere, I suppose?
Yeah, I think what scientists and epidemiologists are trying to figure out what's so bizarre about this season. They are talking about what we call, quote, off-season infections. In other words, viruses and bacterial infections that are happening now when they shouldn't otherwise, or when we haven't seen them otherwise. There are a number of reasons for it, including what the doctor said in the lead, which was the so-called immunity gap. We have for two winters, think about this, during COVID, we have been away from each other, we've isolated, but we've worn masks. And the masks are what have protected us from getting viruses and other, bugs. Because we don't have those exposures, we don't build an immunity. You don't have a natural immunity. Put that together with the fact that people are having less vaccines. There are less flu vaccines than years before, and folks are getting less COVID vaccines. I think this is building, sort of a big immune war, in other words.
Well, okay, we have to go, but I just have to ask, if we continue to do the masks and don't build up our immunity to what's coming around now, do we just leave ourselves in the same situation for future winters when we're going to see this situation?
What a fantastic question, Mitch. And so I think that's for the experts in our community, the scientists, researchers, the people who are going to make our defense systems like vaccines and treatments to really figure out. But I think what we don't want to do is expose our very young children. We don't want to expose the elderly people in our families and those people in our communities that aren't related to us to an illness that then will sort of shut us down and restrict our lives again. I would really ask people to think about wearing that mask on their own.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.